Hello friends, welcome to Technology, Medical and Competitive World channel. Friends, today I will explain one of the important concept, that is autoclave, that comes under the chapter sterilization. Already I have given two videos on this sterilization chapter. This is third video. This is part 3 video, that is autoclave. The autoclave comes under the moist heat sterilization method. That is physical method of sterilization. It's under there is moist heat sterilization. The autoclave works. This is helpful for medical, paramedical and nursing students. Okay, you can see autoclave means there is one of the device. In diagram you can see this is autoclave device. With the help of this we can sterilize the articles. That is autoclave. With the help of this autoclave we can sterilize the articles by autoclave method here. Okay, how can the autoclave works? You can see autoclave works on the principle of moist heat sterilization. Means this autoclave works on the moist heat. Already I have told moist heat. There is steam is created in the autoclave. Due to the effect of moist heat, there is the sterilization of articles takes place. The high pressure inside the chamber increases the boiling point of water for sterilization. Means inside this chamber there is pressure because the lid is closed here. There is no allow the air to come out. There is no chance the air to come out. Hence there is creates a pressure. Due to that pressure, the boiling point of water is also increases. This is like same like pressure cooker. How inside the pressure cooker, why the food is ready quickly? Because of the pressure. Like that here inside the autoclave there is pressure. Due to that pressure there is increasing the boiling point of water. The high pressure is also ensures rapid penetration of heat. The deeper parts of equipments, the moisture present in steam causes coagulation of proteins of microbes, causing irreversible loss of their activities and functions. One thing you have to remember, in autoclave what happens means here is both temperature as well as pressure. Due to the effect of temperature as well as pressure, there is improving in the destruction of microorganisms present on the surface of articles to be sterilized here. ಇಲ್ಲಿ ಏನಾಗುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ ಆಟೋಕ್ಲೇವ್ ಅಲ್ಲಿ ಇಲ್ಲಿ ಟೆಂಪರೇಚರು ಇರುತ್ತೆ ಮತ್ತು ಪ್ರೆಷರು ಇರುತ್ತೆ. ಅವು ಎರಡಕ್ಕರ ಸಹಾಯದಿಂದ ಏನಾಗುತ್ತೆ ಆದಷ್ಟು ನಮಗೆ ಒಳ್ಳೆಯ ರೀತಿಯಲ್ಲಿ ಏನಾಗುತ್ತೆ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಆಗೋದಂಥ ರೀತಿ ಅಂದರೆ ಸುಧಾರಣೆ ಆದಂಥ ಒಂದು ಸ್ಟೆರಿಲೈಸೇಷನ್ ಮೆಥಡ್ ಇದೆ. ಬೇರೆ ಸ್ಟೆರಿಲೈಸೇಷನ್ ಮೆಥಡ್ಸ್ ಕಂಪೇರ್ ಮಾಡಲಿಕ್ಕಾಗಿ ಇಲ್ಲಿ ಆಟೋಕ್ಲೇವಲ್ಲಿ ಏನಾಗುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ ಇಲ್ಲಿ ಟೆಂಪ್ರೇಚರ್ ಇರುತ್ತೆ ಆ್ಯಸ್ ವೆಲ್ ಆಸ್ ಪ್ರೆಷರ್ ಎರಡೂ ಇರೋದ್ರಿಂದ ಇಲ್ಲಿ ಏನಾಗುತ್ತೆ ಆರ್ಟಿಕಲ್ಸ್ ಬೇಗ ಸ್ಟೆರಿಲೈಸೇಷನ್ ಆಗುತ್ತೆ. ಹೀಗಾಗಿ ಇದೊಂದು ಮೋಸ್ಟ್ ಯೂಸ್ಫುಲ್ ಮೆಥಡ್ ಫಾರ್ ಸ್ಟೆರಿಲೈಸೇಷನ್ ಅಂತ ಹೇಳ್ಬೋದು ಎಟ್ ಹಾಸ್ಪಿಟಲ್ ಸೈಡ್. I think you understand. And you can see the procedures for the sterilization methods. Procedures means how can we follow the instructions, or how can we sterilize the articles with the help of this device autoclave. How can you sterilize the articles at hospital side with the help of this device? Procedures one by one you can see now. Initially fill the bottom of autoclave with water. This is autoclave. Remove the lid clamp, have to remove and fill the bottom of autoclave with water. ನೀರು ಏನು ಮಾಡಬೇಕು, ಈ ಆಟೋಕ್ಲೇವ್ ಕೆಳಗಡೆ ಏನು ಮಾಡಬೇಕು, ನೀರನ್ನು ತುಂಬಬೇಕು ಒಂದಿಷ್ಟು. ಈ ಲಿಡ್ ಓಪನ್ ಮಾಡಿ ನೀರು ತುಂಬಬೇಕು. ನೆಕ್ಸ್ಟ್ ಆಫ್ಟರ್ ದ್ಯಾಟ್ ವಾಟ್ ಕ್ಯಾನ್ ಯು ಡೂ? Keep the tray containing the articles to be sterilized in autoclave. After filling the water here, what can you do? The tray, there is one of the tray containing articles to be sterilized. ನೀವು ಆರ್ಟಿಕಲ್ಸ್ ಸ್ಟೆರಿಲೈಸೇಷನ್ ಮಾಡುವಂಥ ಆರ್ಟಿಕಲ್ಸ್ ಏನೇನು ಇರ್ತಾವಲ್ಲ ನಿಮ್ಮಲ್ಲಿ, ಫೋರ್ಸೆಪ್ಸು, ಸೀಸರ್ಸು, ಬ್ಲೇಡ್ಸು, ಅವನ್ನೆಲ್ಲ ಏನು ಮಾಡಬೇಕು? ಒಂದು ಟ್ರೇದಲ್ಲಿ ಇಟ್ಕೊಂಡು ಇದ್ರ ಒಳಗಡೆ ಇಡಬೇಕು. ಯಾವುದು? ಆಟೋಕ್ಲೇವ್ ಒಳಗಡೆ ಆ ಟ್ರೇಯನ್ನು ಏನು ಮಾಡಬೇಕು? ಇಡಬೇಕು. ಆ ಟ್ರೇಲಿ ಏನಿರ್ತವೆ? ಆರ್ಟಿಕಲ್ಸ್ ಇರ್ತವೆ. ಯಾವ ಆರ್ಟಿಕಲ್ಸ್ ನೀವು ಸ್ಟೆರಿಲೈಸೇಷನ್ ಮಾಡಬೇಕಾಗಿರುತ್ತೆ. ಸ್ಟೆರಿಲೈಸೇಷನ್ ಅಂದರೆ ಡಿಸ್ಟ್ರಕ್ಷನ್ ಆಫ್ ಮೈಕ್ರೋ ಆರ್ಗ್ಯಾನಿಸಮ್ಸ್ ಪ್ರೆಸೆಂಟ್ ಆನ್ ದಿ ಸರ್ಫೇಸ್ ಆಫ್ ಆರ್ಟಿಕಲ್ಸ್. ಅವು ಆರ್ಟಿಕಲ್ಸನ್ನು ಏನು ಮಾಡಬೇಕು? ಇದೇನು ಮಾಡಬೇಕು? ಇದ್ರ ಒಳಗಡೆ ಇಡಬೇಕು. ನೆಕ್ಸ್ಟ್ ವಾಟ್ ಕ್ಯಾನ್ ಯು ಡೂ? ಕ್ಲೋಸ್ ದಿ ಲಿಡ್ ಆಫ್ ಆಟೋಕ್ಲೇವ್ and screw down the lid clamps. After keeping that tray into the autoclave containing the articles, what can you do? Close the lid. This is lid. You can see. Where is? This is lid. Autoclave lid. Okay. ಮುಚ್ಚಳ ಅಂತೀವಲ್ಲ, ಇದು lid. This lid we have to close. This is lid, this is safety valve, this is pressure gauge, this is pressure regulating device. This is outer stand, vacuum releasing valve, steam releasing valve, and autoclave body. These are handles. Yes, okay. What can you do? After keeping the articles inside the autoclave, what can you do? Close the lid. And screw down the clamps, lid clamps tightly. Means there are lid clamps. This also lid clamp. This also lid clamps. You have to screw down tightly. ಇವನ್ನ ಏನು ಮಾಡಬೇಕು? ಟೈಟಾಗಿ ಸ್ಕ್ರೀವ್ ಮಾಡಬೇಕು, ಅಂದರೆ ತಿರುಗಿಸ್ಬೇಕು. ಅಂದರೆ ಲಿಡ್ಡನ್ನು ಟೈಟಾಗಿ ಏನು ಮಾಡಬೇಕು? ಇದ್ರ ಮೇಲೆ ಕ್ಲೋಸ್ ಮಾಡಬೇಕು. ನೆಕ್ಸ್ಟ್ ಯು ಕ್ಯಾನ್ ಸಿ ಸ್ವಿಚ್ ಆನ್ ಆಟೋಕ್ಲೇವ್ ಆ್ಯಂಡ್ ಸಪ್ಲೈ ದ ಎಲೆಕ್ಟ್ರಿಸಿಟಿ. ವಾಟ್ ಕ್ಯಾನ್ ಯು ಡೂ? ಅದಾದಮೇಲೆ ಆ ಆಟೋಕ್ಲೇವನ್ನು ಸ್ವಿಚ್ ಆನ್ ಮಾಡಬೇಕು. ಸ್ವಿಚ್ ಆನ್ ಮಾಡೋದ್ರಿಂದ ಎಲೆಕ್ಟ್ರಿಸಿಟಿ ಏನಾಗುತ್ತೆ? ಸಪ್ಲೈ ಆಗುತ್ತೆ. ಆ್ಯಂಡ್ ಮತ್ತೇನು ಮಾಡಬೇಕು? ಡಿಸ್ಚಾರ್ಜ್ ಟ್ಯಾಪ್ ಈಸ್ ಓಪನ್ಡ್. ಡಿಸ್ಚಾರ್ಜ್ ಟ್ಯಾಪನ್ನು ಏನು ಮಾಡಬೇಕು? ಓಪನ್ ಮಾಡಿಡಬೇಕು. ಹ್ಯಾವ್ ಟು ಇನಿಷಿಯಲಿ ಹ್ಯಾವ್ ಟು ಡೂ ಸ್ಟಾರ್ಟ್ ದಿ ಆಟೋಕ್ಲೇವ್. ಮೀನ್ಸ್ ಸ್ವಿಚ್ ಆನ್ ದಿ ಆಟೋಕ್ಲೇವ್. ಮೀನ್ಸ್ ದಿ ಆಟೋಕ್ಲೇವ್ ಈಸ್ ರನ್ಸ್ ಆನ್ ದಿ electricity. Next, after switch on the autoclave, what can you do? The mixture of air with steam is allowed to escape freely. Means already there is air. That air is mixed with the moisture. That we have to allow escape. Because the excess air should not contain there. Because there is steam only. There is you have to keep steam only. Excess air we have to allow escape. Next, what can you do? Discharge tap is now closed. Initially we have to open the discharge tap. After escaping the mixture of air with steam, that we have to close the discharge tap. After removing the air, we have to close the discharge tap. After that, what can you do? Holding period. The steam pressure rises inside. When the autoclave is in a running condition, what happens? There is steam pressure creates, and when it reaches 15 IBS, there is pressure gauge. You can see there is pressure gauge. There is showing pressure. Okay, when it reaches 15 IBS, then we have to, what can you do? From this point, holding period should be 15 minutes is calculated. When it reaches 15 IBS pressure, from that point we have to calculate the holding time. That should be 15 minutes. You should keep. After 15 to 20 minutes, what can you do? When the holding period of 15 to 20 minutes is over, turn off the autoclave. ಅವಾಗ ನೀವೇನು ಮಾಡಬೇಕು, ಆಟೋಕ್ಲೇವನ್ನು ಟರ್ನ್ ಆಫ್ ಮಾಡುವ, ಸ್ವಿಚ್ ಆಫ್ ದಿ autoclave and allow to cool. And that after switch turn off the autoclave, you should not remove immediately lid because there is pressure. So we have to allow the autoclave to cool down. Cool ಆಗಲಿಕ್ಕೆ ಬಿಡಬೇಕು. Next what can you do? Open the discharge tap slowly. There is a discharge tap that you have to open slowly. That discharge tap you have to allow slowly, open slowly, because the steam have to open out, comes out. Next, then after escaping the pressure, after the steam is comes out, what can you do? Unscrew the lid clamps. That lid clamps you have to unscrew. There are lid clamps here like this. This is lid clamp, lid clamp, lid clamp, lid clamp. You have to unscrew, means screw down ಅಂದ್ರೆ tight ಮಾಡೋದು, unscrew means opposite reverse ಅಂತ ಹೇಳಿದ್ರೆ ಓಪನ್ ಮಾಡೋದು. What can you do? Unscrew the lid clamps and open the lid. After unscrewing the lid clamps, we have to open the lid when the pressure is released out. After releasing the pressure, then only we have to remove the lid. Otherwise you can't remove the lid because there is pressure. There is pressure gas that is indicating that reaches to inside the pressure that have to reaches to atmospheric pressure. Then only we have to open the lid, like the pressure cooker in your home. Okay. And after removing the lid, what can you do? Remove the tray containing the articles sterilized. The articles which we have kept in the autoclave, that we have to remove. Those are sterilized articles. Those articles we have to use in your hospitals. Okay, this is about sterilization methods, that is autoclave. Autoclave is important sterilization methods for your examination purpose as well as your knowledge purpose. I think you understand. Please like, share and subscribe my channel. Thank you.